in Egypt. That's a very short bio. I'm interested in AI applications, in robotics and biomedical applications.
Thank you so much, Mustafa. So I am going to start presenting my screen. We will have people join as we go. So we're not going to wait for people, just so that we don't lose on time. I don't know if you can see my screen. Can you see my screen?
No.
No? Okay. And now?
Yes.
Yeah. Okay. So we're going to start the space for now. I'm going to do a little bit of an introduction, take you through the skeleton of how the webinar is going to look like, and then we'll proceed with that. So my name is Boari. I am from Kenya. I like to call myself a global citizen because I enjoy interacting with people from different parts of the world, just through work and outside of work. I am a program coordinator with a deep passion for AI advocacy, as well as sustainability and social impact. Artificial intelligence aims to empower the next generation of African talent, and that is why, as the African Intelligence Club, we aim to make sure that we're creating awareness. We're making sure that more young people know the potential of AI as early as they can. We believe that by equipping young leaders with AI skills, we can contribute to Africa's growth in the fourth industrial revolution, creating solutions that address sustainable development challenges and drive social impacts across the continent. So in today's session, our agenda looks like this. We're going to have an introduction, which is what I just did about myself, and then we will have an audience check-in and icebreaker. So I'm going to present an icebreaker that we're going to engage in, just to be able to get into the groove of the session before the speaker takes over. Then we'll have Mustafa, our speaker, speak to us for about 20 to 30 minutes, and then we will have the closing segment. And then we can ask, if we have any questions or any information we want to get before the end of the space, then we can get them at that point. So when we get to the icebreaker, I just want to talk about, just want to check. Were you seeing my slides as we go? Probably not, because I'm back here.
We were actually.
Oh, okay. Okay, that's amazing. All right. So under the icebreaker, I just wanted to talk about AI, but in a more like just random thoughts or random ideas that you have. So when I was doing my research in 2020, researchers at Google Health developed an AI model that could detect breast cancer in mammograms with greater accuracy actually than radiologists. So the AI system was trained on thousands of anonymized mammograms and demonstrated its ability to reduce the false negatives, or let's call them the missed cancers, by 9.4%, and false positives incorrectly flagged cases by 5.7%. So in the UK and US, hospitals have started piloting this and using it to help radiologists use it as a second option to improve diagnostic confidence. So this early detection is saving lives by allowing treatment to start sooner and improving patient outcomes. That's just an example of what AI has been able to do in the healthcare section. So I just want to throw back the question back to everyone and ask you, what's one area of healthcare you hope AI can improve? Maybe I'll get 2 or 3 people, and then we can proceed to the next part of this. So I just want to know, what's one area, I'll tap it out on the chat box, and then we can have someone say what's the one area you hope AI can improve. So anyone who has anything they have in mind, or even before you joined this call, you probably were thinking about something, AI and healthcare. Maybe you had something in your mind and you're like, oh, I think AI can help us in this in future when it comes to healthcare. Maybe you can just share your thoughts before we get into the session. So does anyone want to speak? Otherwise, I will pick people at random.
I can go first.
Okay, thank you, Raphael.
Yeah, I think one place AI can help in healthcare is definitely in patient management system, where, for instance, in Ghana, access to healthcare is not very large, especially in rural areas, right? So, can there be a system where someone can, from their phone or either a smartphone or a YAM, like they would say, can have a platform where they can send the message to if they have questions, simple questions with respect to some health concerns that they are having. And instead of having to visit the hospital or the clinic every single time, they have a program that they can ask those questions, and the AI program will be able to deliver the answers to them. And if it is something that needs a visit to the hospital or to the clinic, then the program can recommend the nearest clinic or the nearest pharmacy to them so they can continue that healthcare process. So, yeah.
Okay, thank you so much, Raphael. That's an interesting point to bring up. That would definitely make life easier. Does anyone else have something to say? I need one more person and then we can proceed. What's one area of healthcare you hope AI can improve? Um, yes, Jessica, please go ahead.
Yeah, so I think AI can improve in like personalized treatment plans. So it can take data from like your lifestyle, genetics, and like your health like history or record, then it can give you like a personalized treatment plan. And also I think it can help with administrative stuff, because I've worked at the hospital before and it's quite stressful and it takes a long time, which keeps patients waiting because they now have to check your insurance, make sure it's right and all of that. So it can really help like keep the data of like patients and like monies and healthcare. And also I think the last one I would say is if it can predict disease outbreaks, so that like stakeholders, not just healthcare professionals, can prepare for something like that. I kind of feel like it exists but we don't use it. So yeah.
Okay. Thank you so much, Jessica. That's a very good breakdown. Thank you. So if everyone could have something to say, this would take so long because I think there's so many things in the healthcare that we think AI can help improve on. So we're excited to learn more about AI applications from the session that Mustafa is going to be presenting. And so just before Mustafa takes the floor, I'm just going to do a little bit of an introduction for everyone on this space who might not know who Mustafa is. Mustafa is our speaker for the day. He is from Egypt and he's going to be taking us through this space. Dr. Mustafa is an assistant professor in robotics and mechatronics at the British University in Egypt. He has a PhD in robotics from the American University in Cairo. His research focuses on micro and nano robotics, artificial intelligence, applications in robotics, and biomedical robotics. So this tells you he's the best person to talk to us about AI applications in healthcare. He has played a key role in developing the mechatronics and robotics program in BUE, where he teaches modules like soft robotics, sensors and instrumentation, and mechatronic system design. Going through this, it just shows me or tells me how much of a privilege this is to be sitting in this space just waiting for Mustafa to speak to us. And it's very exciting for me actually, and I hope everyone is feeling the same way. Dr. Mustafa has supervised award-winning student teams in global robotics competitions, including the 2024 Robo Games and the Global Robotics Challenge, achieving top international rankings. He also serves as a technical coordinator for the, I think it's supposed to be GAIA Author, I don't know, or maybe I'm butchering the word.
It's called the Gaiathon, Gaia Club. By the way, Gaia Club
Okay.
is founded in Ghana.
Oh, interesting. Maybe we
Yeah.
should have a partnership sometime. Yeah, Gaiathon, which is a competition on IoT systems in Africa and is the focal point for the Gaia Club in Egypt. He's also published extensively in the fields of robotics and artificial intelligence. So we're so happy to have you here, Mustafa. This is an exciting space or experience. You can see how many people are on this call. We are all looking forward to see what you have for us. And so I'd like to give you the floor. You can share your presentation and run this space. We're excited to listen to what you have. And for that, I think everyone should use the emojis on the screen just to welcome him as a standing, ovation. So I've already started the train of emojis. So people should use the emojis as we introduce the speaker. Mustafa, please go ahead.
Okay, I will share the presentation now.
Thank you.
Now you can see it.
Not yet. Yes, now we can see you presenting. Yes.
Okay. So today's presentation will be about the role of AI in transforming healthcare in Africa. This short brief, I will not talk about the bio again. I've done enough with the bio. Thanks for you, AI. So now let's go direct to the AI. What is the meaning of AI? What is artificial intelligence? This presentation will explore the potential benefits, the challenges, the real-world applications of the AI in improving the health sector outcomes across our continent. So what is an AI? AI refers to the use of an algorithm, machine learning models, to analyze complex medical data. As Jessica have said, that when we can use the medical data from the hospitals, we can enhance the healthcare rather than having long queues, enhancing or relieving some pressure on the health sector we face in Africa. So this can be done by using the AI. So keep in mind a very important term called data. Data is very critical for an AI. Okay. Second point is that AI enables machines to simulate human intelligence, like recognizing patterns in images. As Farah said, we can use AI for recognizing cancer by learning the AI models related to the cancer, by processing large data sets and make predictions. Example for AI applications may be used in medical image analysis, predictive analytics for disease outbreaks, depending on a medical history for a patient. A virtual health assistant, as Rafael have mentioned during the ice break, that we can use a virtual health assistant in the rural areas, and we will see it in this presentation, how to apply this one. So before going through the AI applications in healthcare in Africa, we need first to define what are the challenges that we are facing in our healthcare sector in Africa. So Africa faces numerous healthcare challenges, like inadequate infrastructure, shortage of healthcare professionals, and limited access to medical service. So addressing these issues, these three main challenges, is crucial for improving the quality of care. So some numbers may make us feel the challenges we have in Africa. According to the WHO, World Health Organization, there is around 1.3 physicians per 1,000 people in Africa, and far below the global average, which is about 3.5. So we are only 1/3 of the global average, and this is a very, very, very problem number. It's not good. Second one, the World Bank and UNICEF reported that 42% of the population in sub-Saharan Africa lives more than 2 hours far away from a hospital. And I'm sure we have the same problem here in Egypt. Maybe not 2 hours away, maybe around 1 hour or 1 hour and a half. We are in the same range. Also, I have a friend in Tunisia. He told me that they have the same problem, that some areas, in rural areas, there is no near hospital. The nearest hospital is around 1 hour away from his village. According to the WHO, half of the African populations lack access to the essential healthcare service, to the essential, the basic service. Another one is the hospital beds. Africa average 1.3 hospital beds for 1,000 people, while the global average is 2.7 beds for 1,000. So it's about 1/3. We are below the global average. So AI has the potential to address these challenges by improving the healthcare delivery, enhancing diagnostics, and enabling telemedicine service. It can support the development and give solutions tailored to the needs of the African populations. So what are the key applications of AI in healthcare? First key application is diagnosis. By giving the machine learning model or the AI model data about specific disease, for example, malaria, fever, corona or COVID, whatever, and give him data about the feelings, the symptoms, some analytic data, and it can be used as a model for diagnosis the disease. Another one is the telemedicine, and we will talk about it in detail later. Predictive analytics, personalized medicine, which is tailored to you, tailored to the person himself, because the medicine that can be used for Mustafa is not fit, may not fit with another one, because Mustafa has a certain type of genes that can accept this medicine, but for example, another one may have his body or cannot accept this medicine. So we can use AI based on your personal health, based on your history, medical history. It can give you a tailored medicine. Another application is surgery. AI can be used in surgery, integrated with robotics surgery. Finally, AI and IoT can be used in hospitals. And we will see how to integrate both artificial intelligence and Internet of Things in hospital to enhance the service of healthcare. So in diagnosis, as we have said, it can be used to enhance the accuracy by analyzing medical data and identifying the patterns. This leads to earlier detection of diseases such as cancer, diabetes, and improving patient outcomes. And by the way, I have a research now with one of my students by training a machine learning model for a diabetes prediction based on the medical history of a person, his age, his life, his weight, his blood pressure, several parameters. We are learning the model, and it can predict before, in order to warn you that you are a pre-diabetic or not. before reaching a severe diabetic case. The second application, and Raphael have mentioned this one, is a telemedicine. We call it a telemedicine application. This is an integration of AI in telemedicine for remote consultations and monitoring. As we have addressed in the challenges, that in some rural areas, you are 2 hours far away from a hospital. What will you do? Shall you wait for the 2 hours? No. If you have a telemedicine application integrated with an AI, we can use it to make healthcare more accessible. Patients in remote areas can receive a timely medical advice, reducing the burden and pressure on the local facilities. We also know that the government have to improve the health sector by building hospitals. But in parallel with that, we cannot make a pressure on the local facilities. We can relieve some pressure by using a telemedicine application. Another key application for AI is a predictive analytics in healthcare. AI-driven predictive analytics can forecast the disease outbreaks and patient admissions. By analyzing the historical data, healthcare providers can allocate resources more effectively and improve the overall service delivery. For example, we have a village that we are sure that is maybe infected with malaria. So we can allocate based on our analysis or on a previous data or on a historical data for this village. We can allocate allocate the medicine of malaria for this village. The personalized medicine through AI. We can use it by tailoring treatments, tailoring medicines to the individual patients based on their genetics, on their lifestyle data. This approach enhances treatment efficiency, minimize adverse effects. AI in robotic surgery. AI in robotic surgery enhance the precision and control. Maybe we cannot know this one good because we have not reached in our continents a robotic surgery or a full automated surgery by robotics. But in the Western areas, like Europe, Germany, and US, they are using a robotic surgery in their hospitals. And not only robotic surgery, but they are enhancing it with an AI models. The final one, and it's a key factor, if we can apply it in our hospitals, it will be perfect and enhance the healthcare service. By integrating both artificial intelligence and the Internet of Things in a patient triage system. We know the triage system is emergency sector. The emergency sector, about several people came to the emergency. How can you prioritize them? Which case is the most priority to enter now? So it can be used by an AI and IoT to ensure quick, data-driven decisions and improving the efficiency of patients in the emergency departments. The integration of AI and IoT provides also a smart, efficient, automated solutions for hospitals to manage the emergency patients, improving the overall healthcare delivery and patient outcomes. So, opportunities in Africa, yes. How come? By addressing the shortage of healthcare professionals, many African countries face a critical shortage of doctors, nurses, and healthcare workers. And how can AI solve this? AI can solve this by analyzing medical scans. For example, make a scan, whatever it's, for example, MRI scan, and AI can make a scan, give you a report or a brief about this MRI scan, interpret lab results. AI can do this based on the learning it have learned, on the data if it have learned on it. Allows these less experienced healthcare workers to make informed decision. So we can use AI to solve this problem. Second one, if you can see, this is a machine called an IDX-DR analysis report. This is a German device. It uses in Germany to just examine your eye and give you a full report without interference from any doctor or any healthcare provider. Second problem was reaching remote areas and underserved areas. How can we have this problem or solve this problem? By AI-driven telemedicine and mobile health applications can expand healthcare access to rural and unpaved districts. By having AI chatbots providing basic diagnosis, treatment suggestions, or directing patients to the nearby facilities. Final one, and we have it in Africa, is the language barrier. Africa is linguistically diverse. We have in our continent more than 2,000 languages spoken across the continent. Not all the continent can speak English. Not all the continent speak French. Not all the continent speak Arabic. Even the Arabic in Egypt is a little bit different from the Arabic in Tunisia, is a little bit different from the Arabic in Morocco. For me, for example, when I traveled to Ghana, I met another people or other colleagues, but they were French tongue, and I cannot communicate with them easily. And they are talking French, and I'm talking in English. So this is a problem we must address, and it is already addressed. But AI can solve this problem. All of us have in his mobile and a translator, AI translator or Google Translator, whatever. So this can also, AI can help in this problem or in this challenge, that AI tools translating health information and communicating with patients in multiple local language to improve patient understanding and compliance. And by the way, I'm working on a research by translating the medical expressions, whether it is in English or in Arabic, to be very simple for the people to understand it here in Egypt. Even if you can speak, for example, English, and I told you a medical expression in English, you will not understand it. Mustafa cannot understand it because their medical expressions are very difficult to understand. It is not easy or not straightforward to understand it. So we are working in, when you say a term, you can translate it so a normal man can understand it. So, is it easy to apply the AI in Africa? Yes. I mean, is it a straightforward? No, it is not easy to apply AI in Africa, in healthcare in Africa. Why? Because we have limited infrastructures. What do I mean by limited infrastructures? The main basic for an AI is an internet, a communication satellite. And we lack for a good internet, a stable internet for an AI. For example, if I give you a model for a telemedicine application and you are in a very far away district or very far away village and you don't have, for example, electricity or, for example, a network, how will you communicate with the telemedicine? So the limited infrastructure is a challenge for applying AI healthcare in Africa. Second one, and I have told you at the beginning of the presentation that this term is very important, the data. The data scarcity and quality is very difficult in Africa, even here in Egypt. I'm talking about Egypt. It's very difficult to have a good data from a medical sector to train a model. And if I train my model on a data from people from Europe or from America or whatever, from any other country, it will not fit with the people here in Egypt. Why it will not fit? Because the people in Egypt is different from the people in the US or Europe, and different from the people in Africa, and different from the people in Asia. It depends on the lifestyle, the country you live in, the environment, the way of your lifestyle. So you must have a data that represents the people of your country. So the data quality in Africa is very shortened, and we lack a good quality of data. Another one is the high cost of AI technology. in order to have a good network or good internet, you need an infrastructure, you need antennas. So this needs money. So the high cost of AI technology. Finally, the bias and inequality. As I have said during the data, if the bias is an inequality for the persons, the data we can train a model here in Egypt, I cannot give it to you in Ghana and say you can use it, or in Kenya and you can use it, and vice versa. If you have a good model, a perfect model in Ghana, you cannot offer it to me because it will not give me the same results that you are expecting from your country. And finally, the lack of a skilled workforce. And that's why we are having this webinar, in order to motivate and encourage the youth in Africa to study and to go through AI courses in order to have a very skilled workforce that can be one day learning this continent and be one of the pioneers countries. So, are there any case studies for AI applications in Africa? Yes. We have several case studies and successful case studies. I'm talking about successful case studies in Africa. The first one is called an application called Babylon Health application. It's in Rwanda, by the way. It was developed in 2016 and they are continuing it. And it has more than 2 million users in this application. This one is AI-powered telemedicine service using the mobile platform Babel in Rwanda, provides access to healthcare, especially in remote areas. This AI chatbot helping assessing the symptoms and connects patients with doctors through virtual consultations. So, what is the effect of it in the health sector? First, you relieve the pressure and burden on the local facilities. I am just feeling some fever, some running nose. I just text on my chatbot on this application, and he can assess my symptoms and can give me a medical consultation. So no need for Mustafa to go to the hospital and wait in the queue. So this is one. Number two, it's cost effective. Number three, it's a scalable solutions. If it is integrated with a health system or the health government. Another application is in AI Uganda. They developed an app to tells your doctor if you have malaria or not. This application in Uganda just receives a lab results, interprets these lab results, and give you a final conclusion or a final consultations. So this, what is the positive impact of it? That you are reducing the healthcare workers, which we are already lacking in Africa. Another one, sorry about the title, it's in Ghana, in your country. I don't know if you are familiar with this one or not. It's Zipline drones, which are delivering medicines in Ghana for rural areas or the remote areas. So what we can do now is we should encourage and we should run and push for collaboration among governments, healthcare providers, and technical companies for AI potential applications in healthcare. Public-private partnerships can drive innovations from the youth, from you as students, which are full of energy, creativity, and innovative people, and ensure sustainable healthcare solutions. This is just a part of my research team who works with me in AI application in healthcare. For example, Engineer Amr, he's working for AI for blood glucose monitoring, which was, I was saying at the second slide, for detecting the diabetes. Miral is working for an AI-powered soft robotics endoscopy. An endoscopy she is developing, and she is manufacturing an endoscopy from soft robotics and using an AI camera to track the position of this endoscopy. And finally, Zahi is working in AI-enabled Barrett quantum robot for surgery, we have a quantum robot that can be used for surgery, for not dying, if you know they're not dying during surgery, but it will do it using an AI to optimize the trajectory. In order to conclude and our presentation, so we can see from this one that applying AI in healthcare can significantly benefit Africa by overcoming the challenges and leveraging the AI's capabilities. We can achieve a more effective and equitable healthcare system for the continent and for the people of this continent. Thank you very much. I hope you enjoyed this presentation. It is not a little bit technical, but it is an overview of what is an AI and how can we use it AI and what are the challenges we're facing in this AI. Thank you very much.
Thank you so much, Mustafa. This was really amazing. We've learned a lot, and thank you for breaking it down and focusing on Africa, because it helps us see what's already happening, what's being done, and what we can do. I would also like to mention that I think I can see one of the engineers from the research team. I think Zahi, I think I'm mentioning his name well. So Zahi, would you want to say hi to everyone? I'm just mentioning you because I can see you're already doing something in light of AI in healthcare, and it's nice to have someone already there. Zahi, can you hear us? Would you want to say hi? Okay, you texted. Okay, thank you so much for being here.
You can speak, Zahi.
Hello. Can you hear me?
Yes, we can hear you.
I'm glad to be attending this session with you. This topic is actually really important, and its importance is also involving in many healthcare applications. One of them that I'm currently working on is developing a type of soft robotics called the Continuum Arm Robotic with Dr. Mustafa Abdulaziz. And this we will have to involve machine learning to automate the process of surgical suturing or surgical knot tying. So it can be implemented in minimally invasive surgeries to perform precise and most accurate surgery in confined or tiny spaces. So I'm glad to be here learning from Dr. Mustafa Abdulaziz and in engaging in this community.
Thank you so much. We're also happy to have you. It's amazing to see someone who is actively working on change. So now we're going to move into the question and answer session. Hopefully we can take up like 3 to 4 questions before we can finish, because we have 10 minutes to our time. I can already see Isaac has sent a question in the chat box, and his question is, can you recommend a program in machine learning with affordable cost? So Mustafa, do you think you're able to recommend a program in machine learning with affordable cost?
I think Mustafa left the call.
Oh, okay. Okay, he's here. Hi, Mustafa. You're on mute.
Yes, sorry for this. This is one of the challenges. We cannot have a good AI application in Africa.
Okay, sorry for that. So we are in the question and answer session, and we have one question from Isaac, and Isaac is asking, can you recommend a program in machine learning with affordable cost?
There is too many free applications for machine learning. You don't need to go to a high cost. Maybe if he's talking about a data, it's this is a problem, because having a data, it may be costs. So if this is means, so it differs from one to another. But there are several websites that can provide data for free. I can type it later in the chat text.
Yes, please. I think we'd appreciate that. Thank you. Dennis, did you raise your hand? I think I saw a pop up.
Yes, but it wasn't intentional.
Okay. Does anyone else have a question or a follow-up? Yes, Alexandra, please go ahead.
So I know that sometimes AI can produce wrong results. Sometimes something like AI hallucination can happen. So are there any ways to help reduce that or prevent that in the healthcare industry? Because something like that can cause a lot of damage and yeah.
Yes, it's not sometimes, maybe many times, or all the time, AI model can produce wrong results. But what is the main cause for these wrong results is the data. If you are not, the data and learning a model is like you are learning a baby. If you are giving a baby a banana and teaching him that it is an apple, so he will learn that when he sees any banana, he will say it's an apple. So the wrong data will result in a wrong result. There is a terminology or an expression in AI we use called rubbish in, rubbish out. When you give the model a rubbish data, the results will be rubbish. So it depends on the data and how you are going to learn him. So for the medical sector, you should give him a proper data. Proper means not only from the size, but from the quality itself. For I cannot give him data about men only and no female data. This is wrong, number one. Number two, any disease, it can have different results or can have been different diagnoses according to age range. The infants differ from the adults, differ from the elderly people. So this is another different aspect. Third one is the environment itself and the lifestyle of people, which also differ from one person to another, from country to another, from the genes itself. So it's all depends.
Okay, thank you, Mustafa. So we have another question. Janet is asking, what are some of the ethical considerations that must be taken into account when implementing AI solutions in Africa healthcare systems?
The ethical is if I have agreement to have a data from someone or from a patient or from the medical history, this is ethical. You should medical sector or in Africa should be flexible with provide use it for research, for science. It's not a privacy. So it's like a mutual benefit.
Okay. Mustafa, you were breaking a bit at some point, but I think, Janet, have you gotten the answer? Maybe you can just type if the answer was satisfactory. And then we have, hello?
Yeah, sorry, Boari. I couldn't really hear him well. So I don't know if you can repeat the answer.
Yes.
Implementing AI in healthcare system is the agreement of having the solution. You cannot have it or steal the data from a medical institution if that's number one. Number two, when developing a model depend on the quality of the data.
Mustafa, okay, but we keep losing some parts of your sentences. I'm hoping it will get better. So we have another question from Daniel. Daniel says it's great and insightful presentation on AI in the health sector, but to what extent do medical practitioners in the sector need to equip themselves before reaping the full benefits of AI and its applications?
Well, AI models or the AI applications will help them. It will not make them, we will number two, we need to teach them or to learn them how to use the AI models, how to train the AI models. And I guess these are what are they doing? To collect the data itself is a research. It is not just an easy to have a data. It's a research. It can help in clinical and decision-making skills. It will multidisciplinary collaboration. I am a mechatronics engineering, and I'm collaborating now with some doctors who need will collaborate with a surgeon. In another application, we were collaborating with pharmacy about the medicines, their alternatives. So selecting the proper medicine for you. So have a multidisciplinary collaboration. Another one is if you can educate the patients the role of AI in their care and remove their fears, promoting transparency, this is good for building trust in AI. Advocacy for the responsibility of the AI, it's another. Understanding the AI fundamental people to be more educated, more experienced in this area. In hands-on experience with AI-driven diagnostics, administrative tools, the data literacy, how to interpret and analyze output generated by the AI models to make informed clinical decisions. Comfort play a critical role in the successful of implementation and utilization of AI in
Mustafa, so
yes.
The network keeps breaking a bit, so I'm thinking we can still get these questions and send them to you, and you can send us a written answers, just so that the people who've missed out on some points can probably follow through with the answers. But this is, I think we do not have any other questions. I think since it's 1 minute, post the 1 hour space that we allocate for this space, we would like to finish the space. One, I'd like to say thank you so much for being available and for the amazing presentation. It's been quite insightful. I think everybody else would agree with me. And from the emojis that they are going to use, you're going to see that we have had a good experience and we've enjoyed this space. We've learned a lot, and we're looking forward to even having this presentation after the space so that we can use it for maybe future references. Two, we thank you so much for having your team on the call. We can see Zahi here, so that shows us that you made a point to have people join the call just so that we can see what's being done. So that's really amazing. And we had mentioned that the people who sign up would get access to a course, 4 week course that they would be able to explore. So we're looking forward to that. We'll follow up with you this coming week, and so people can have access to that. We would love to continue working with you in future. So in case you get ideas on how we can have a good collaboration, please let us know. And from our end, we will get back to you on any future projects we would want to work on with you. So Esther, Janet, and I will be actively in contact with you. For the rest of the people who attended this space, I would like to say thank you so much for taking time out of your Saturday to be here learning about AI. I know it would be better to be out there having, spending time with your friends and your loved ones, but it's just nice to have you here. In case you need anything or you want clarification or you want to see how you can contribute more to the African Intelligence Club, I have shared email addresses on the chat for both Janet, Esther, and I. And yes, Janet, he's going to share the presentation. I will share it with the rest of the team once I have it on email. So everybody else, please, if you want to send us emails, those are the email addresses you can send, and we will get back to you as soon as possible. Otherwise, thank you so much for being here. If anyone has any remarks or anything to say, you can send a chat or you can unmute yourself and speak, but that is it from my end. Thank you.
Thank you very much, Barry. Thank you for the all. Enjoyed the presentation, and see you in the course. It will be for free by building a model and learning this model and see the results at the end. I hope you enjoyed. Thank you very much. Thank you for
Thank you.
this
Bye.
opportunity.
Thank you.